Welcome to episode 2 of my amazing free 6-part video series regarding my core and back immersion therapy. In the last video, I showed you why the old shotgun approach for back pain relief isn't the best way to achieve a life without back pain, to have a stronger core and improve overall posture. And I introduced to you the core and back immersion therapy and explained why it works better. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In case you haven't watched the first video yet, make sure you do that right now because I covered a lot of important things. And if you're serious about regaining life without back pain, to have a stronger core and improve posture, you don't want to miss it. And in this video, I'll be covering a lot of groundwork, the importance of how to finally engage your core muscles without back pain exacerbation, and learn about the proper breath work, which is the connection with your diaphragm, your pelvic floor, the abdominal muscles, your lumbar spine muscles, and your glutes. The lumbo-pelvic complex, which is the combination of your core muscles, which most people think the core is just your abdominal muscles, and they forgot it's a complex. It's a movement body mechanics that you want to make sure they are engaged and stable, which means when you do your movement patterns, you're not hurting your joints. If you're doing household chores, doing bending activities, lifting, carrying things, and if your core is not engaged, then you ended up with your lumbar spine unstable. So that's why in this video, I'm going to show you what is lumbar stabilization and why the breath work is so important to incorporate to finally brace your core and combine all of those aspects from your diaphragm, abdominal muscles, lumbar spine, musculature, your glutes, your pelvic floor, and the core, the abdominal muscles as well, all together. Now that being said, let's talk about how you can get results fast with my core and back immersion therapy and exactly how can you get started today. First thing you need to do to learn is the proper breath work. You can do this in sitting, standing, but the best position right now for absolute beginners is to lie on your back because you're not against gravity. When you're sitting up and standing, you have a tendency with weak postural muscles, you might end up with a little bit hunched forward position or whatever position that you're not stable. So that's why lying on your back, your organs will not be pulling you down towards the gravity downwards. So when you lie down, your abdominal muscles are more relaxed and you'll be able to feel the engagement while lying on your back. So I will demonstrate how to fully engage your core without exacerbating your spine, any back pain, tweaks and aches and pain. You want to make sure when you do your exercises, it's not causing more pain. I don't believe in no pain, no gain because pain is something very important signal from your body to tell your brain something's wrong. And actually pain, when you have pain that gets triggered, it causes more weakness. So what's the point of exercising that causes more pain? And you know if it's a good pain or just muscular weakness. So that's the big difference about that. And today, those deep core muscles as well as your tiny pelvic floor muscles is part of your core that you needed to be lifted up to help support your overall posture. Do you know that your neutral spine is just exclusive just for you? It will be probably different from mine and your friends and your family, and everyone's unique. And that's why once you find out what's your neutral spine, that's when you're going to figure out what's the root of your problem. So neutral spine refers to the natural shape of your spine. So there's a cervical area and the lumbar area, and that's when there's a natural curvature, a small C. So it's a little bit extension in your cervical and in your lumbar, and then your thoracic is in the opposite way with a little bit flexion. However, there's the imbalance when you have a flat neck, which is a straight extended cervical spine, or a flat back, or an increased lordosis, which is too much hyperextension, and that's causing pain and stiffness and tightness that causes nerve damage, impingement, stenosis, and all of those areas. So with this video, I'm going to utilize the core and back immersion therapy to start the recovery process, which is a combination of Pilates, yoga, and physical therapy fused together. And number one is the proper breath work, as I said, and you can practice right now with me. Find a mat, get ready, get something comfortable with your clothes so you can move freely. As that all makes sense, so let's start the program right now. You're going to lie on your back. Grab the back of your thigh, sit up straight, chin tuck, slowly roll down one vertebrae at a time, and make sure your knees are bent so your spine is more in a relaxed position. So you can check. Place one hand at the small of the back, one on your abdomen so you can feel your breath work. So now, if you can slide your hand and the back of your hand is slightly touching it, then in your neutral position. However, if you're overarching and you can slide all the way to your forearm, then you have increased lordosis. So that's when you can slowly like, hey, I'm overarching. Let me place the back of my hand instead and slowly press it down, and just a natural curvature for now, and hold that position. But there are some people as well that their back is so flat on the ground and you can't even slide your hand. So that's when you're gonna arch a tiny bit and slide your hand. So it's the beginning start to know your neutral spine. Make sure your back and shoulders are stable, head straight back, nose pointing to the heavens, knees are slightly bent, feet pointing straight, one hand on your abdomen, and you can pretend if there's a cup of coffee on your pelvis and that cup of coffee is spilling somewhere. So if you place it here and you're flattening your back too much, guess where the coffee is spilling? Towards your chest. And now let's pretend the cup of coffee is spilling towards your thighs, then you're overarching. So that's anterior pelvic tilt position or posterior pelvic tilt. Another problem that some patients mostly have if they have sciatica and sacroiliac dysfunction, there's one side weakness. So example, if my problem side is my right side, I usually see my patients with the right side going down on their lateral pelvic tilt. So if I place my thumb on the top of my iliac crest and my left as well, and then I'm gonna connect, lift my buttocks off the mat first to engage everything, slowly roll down, and then I'm gonna connect, and I might find, let's pretend I'm hiking down on my right and I'm lifted on my left. So now my right pelvis is lower than my left. So that causes a lot of drooping and muscle imbalance. So find out right now, place it, lift your buttocks, go down and connect. So let's pretend I have my right side lower, and that's a muscle imbalance. So those are the things you can check right now on your neutral position, pelvis position, and now we're going to engage everything with our breath work. So place the hand on your abdomen and one at the small of the back. Let's take a deep breath through your nose. As you breathe in, you're going to expand your belly out to put a lot of air from your lungs and really make the diaphragm lower down and feel that lower ribs flaring. And then as you exhale, you're going to slowly breathe out through your mouth as you slowly pull your navel to your spine and slowly engaging your abdominal muscles in, and then imagining not to pee to engage your bladder without pressing your hand at the small of your back. Again, inhale through your nose, belly rise, and then slowly pull your navel to your spine, and then breathe out in conjunction with imagining not to pee. We have 3 more to go. Inhale, belly rise. Exhale, breathe out. Squeeze your core in and breathe out. I'm not talking about just pushing your belly out, but really lowering your diaphragm. Inhale, lower your diaphragm. By breathing in, you're gonna feel your abdominal muscles pushing down the organs down, so you have more space for your lungs. And then breathe out, squeeze your core in, brace your abdominal muscles, tighten as hard as you can, and breathe out. Without spilling the coffee if they're lying on your pelvis area in front of your abdomen area. Inhale, exhale, breathe out. Last one, inhale, and breathe out. Now, as I said earlier, we're gonna practice a little bit posterior tilt and arterial tilt. So this is a great exercise just to massage your spine without moving your knees and your hip flexors. You want to keep everything stable. We're just moving a little bit 12 o'clock and 6 o'clock position. If your upper abdominal muscles is your 12 o'clock, you push down, you spill the coffee towards your chest. Inhale and exhale, breathe out. Inhale, exhale. 2 more. As long as there's no increasing pain. Last one. Inhale, belly rise, exhale, squeeze in, and breathe out. Now we're going to combine the lateral pelvic tilt. If your right side is lower and you're tilted this way, then you're gonna target the right thigh. You're gonna lift your right leg to 90 degrees, keeping that pelvis stable, placing one hand, your right hand on top of your right thigh, keeping your knee bent to 90 degrees, toes pointing away, belly rise. Inhale. As you exhale, squeeze your core in and then isometrics, keeping your back stable and gently pressing against your thigh without moving your thigh. I'm keeping everything stable. Isometrics means static. There's no movement, but there's some contraction of your muscles without movement. And then breathe out your mouth and hold it for 5, 4, 3, 2, 1, and then relax. Again, so if this is lower, as I said, we're gonna lift this up by lifting your right knee to 90 degrees, toes pointing away. Place the hand in front of your thigh and inhale, belly rise. Exhale, squeeze your core in, press. And then relax. Last one, lift 90 degrees, hold this position, belly breath, inhale, exhale, squeeze out, and isometrics. And relax. Okay, after doing that, if your problem is your left, then let's do the left side. Place your hand on the top of your thigh. If this left side is lower, you want to lift this up by engaging your left hip flexors and then hold that. Inhale, exhale, keeping your spine in neutral position. So I'm placing my hand at the small of my back. I don't want to flatten my back. I want to engage. That's why it's lumbar stabilization. You want to keep stable and hold that position and hold it for 5, 4, 3, 2, 1. So if you want to try both sides to really find out which one is your weaker side, you might find, hey, I'm right-handed. How come my left leg is stronger? That's when you figure out, hey, even though I'm right-handed, I need to strengthen my right hip more. So this is how you're going to figure out. So my left side is my weaker side and I'm right-handed. And usually that's okay to have a little bit normal weakness. But if you can feel getting more fatigue easily, then you have something more problem. Fatigue with pain, stop. But if it's just fatigue, then work on it. Again, last one on my left. Inhale, belly rise. Hold it for 5, 4, 3, 2, 1, and relax. And my recommendation is do another set of 5 on your weaker side. So after doing the lumbar stabilization, on your back, on your core, you want to engage them all. After doing that to engage, now we can do some tabletop, which means you're alternating lift. So 90 degrees bent on your right leg first, 90 degrees on your knee, on your hip. As you breathe and lift to 90, inhale, belly rise, while keeping my hand at the small of my back, making sure they're stable. And then exhale, tap down slowly and breathe out. And then switch to the other side, inhale, belly rise, exhale, squeeze, and down. Again, alternating left and right without twisting your spine. Inhale, exhale, down. Belly breath, lift, 90 degrees, exhale, down. Left side, inhale, exhale. Right leg, again, tabletop, breathe in, one breath, one motion. Left side. So you're gonna feel you might getting tired. And once your lumbar spine starts pressing closer and closer to the back of your hand, then stop. You don't have to do 10 times. You can stop at 5 repetitions each leg. I'd rather have quality than quantity. So if I can still continue and my back is still that neutral spine, then continue. But as I said, if it's getting weak, then stop. And that's it. I'm hoping you learned a lot on my video too. So you want to make sure you be on the lookout on how to continue with this program by video 3 or episode 3. And I'll be releasing that within 2 days. And if you want to learn more about Pilates, yoga, and physical therapy, health, and wellness, please subscribe to my channel, ring the bell so you won't miss anything. Like and share this video. Every like you give to my channel, you are supporting me. My upcoming back masterclass, I'll be sharing a lot more strategies with you, such as printing technique, self-myofascial release, best secrets utilizing a ball and elastic band, and the PNF patterns. So make sure you stay on the lookout because in a few days, I'll release more information about it and I'll exactly show you what's included. In the next video, I'll show you a simple trick that you can use quickly to feel stronger on your core that you can finally engage those muscles that's been lacking and you don't know how to finally connect mind-body awareness and be mindful on all of those muscles that will support your spine and your overall posture. This is literally the #1 secret that I've been using for years and I barely ever talked about it in public. So stay tuned because what I'm about to share with you in the next video is going to blow your mind. I'm hoping you enjoyed my video today. Always remember there's video 1, you have to go back first. Check it out over here. And if you have time today, video 3 will be released here in the next few days. If it's still not out, it's still not be clickable, but it will be ready in a few days. Always remember, be safe, be well, and healthy. See you in my next video training. Bye!